Hello everyone. Today I am here to demonstrate you about the examination of radial pulse. But before that, we will be discussing about the identification data of the patient. First is name. Name of the patient is important for addressing the patient and for maintaining the records. Next comes the age of the patient. Age of the patient is important as some diseases are age specific, more common in children, more common in elderly. Example, Alzheimer and atherosclerosis are more common in elderly people. Next comes the sex of the patient. Sex of the patient is important as some diseases are more common for females, some are more common for males. The next comes the religion of the patient. The religion of the patient affects the dietary habits of the patient, and in some religious customs may lead to some diseases. For example, covering their whole body by Muslim women leads to vitamin D deficiencies. The next one is occupation of the patient. As certain job exposes individual to specific health risk. Factory workers are more prone to chemical poisoning and noise-induced deafness, and healthcare workers are more at risk of infections like hepatitis B, tuberculosis, AIDS, etc. And then comes the address, postal address of the patient. One more thing important is, in address of the patient, we have to take the complete address of the patient. And because address of the patient is very beneficial and very important for maintaining a proper communication with the patient and to maintain records also. Various arteries we can examine are temporal, facial, carotid, brachial, radial, femoral, popliteal, posterior tibial, and then dorsalis pedis. But we prefer radial artery more because it is more superficial and lies on the bone. For examination, if you are a right-handed person, stand on the right side of the subject. If you are a left-handed person, stand on the left side of the subject. And before examination, you should take the permission of the patient. Now, I will demonstrate you about the method of examination. For examination, the patient should be comfortable, forearm should be relaxed, forearm should be semi-pronated, and the wrist should be semi-flexed. We have to examine the pulse by 3 fingers: index finger, middle finger, and ring finger. Index finger stabilizes the artery, middle finger reads or feels the pulse, ring finger prevents the backflow of the blood from the palmar arch, and most importantly, we have to count the pulse for complete 1 minute. Radial pulse is examined under following headings. Rate of radial pulse. Normal adult rate is 60 to 100 beats per minute. When the rate is less than 60 beats per minute, it is bradycardia, as it is seen in sleep, athletes, old ages, heart blocks. And when the beat is more than 100 beats per minute, it is tachycardia, as it is seen in fever, anxiety, nervousness, fear. Radial pulse are examined under following headings. Rate of radial pulse. Normal rate is 60 to 100 beats per minute. When the rate is less than 60 beats per minute, it is bradycardia, as it is seen in sleep, athletes, old ages, and heart blocks. When the rate is more than 100 beats per minute, it is tachycardia, as it is seen in fear, anxiety, fever. Pulse rate in children is 80 to 120 beats per minute, and in case of infant, it is 600 to 160 beats per minute.
Next is rhythm. There are 2 types of rhythm, regular rhythm and irregular rhythm. Normally the rhythm is regular. Regular rhythm means that between any 2 pulses, the time interval is same. Regular rhythm, it is of 2 types, regularly irregular and irregularly irregular. Regularly irregular, for example, after every 2 beats, 1 beat will be missing and it will continue. It is fixed. Then the other one, irregularly irregular, means after every 2 beats, maybe 1 beat is missing and next time 3 beat is missing. So there is no fixed pattern. Next is volume. Volume is expansion of blood vessel. In healthy individuals, volume is good. Low volume is seen in shock and dehydration. High volume is seen in fever and exercise. Condition of blood vessel. Condition of blood vessel is examined by using 3 fingers. Index finger is to stop blood flow. Ring finger is to empty vessel, and middle finger is used to feel the vessel. the blood vessels are soft, but in elderly people, the vessels become hard and you will feel a cord-like structure when you will palpate with middle finger. And you can see this in case of atherosclerosis in elderly people.
This character is of two types, non-collapsing and collapsing. Normally, character is non-collapsing. Collapsing character can be seen in aortic regurgitation. You can examine collapsing character. With left hand, you have to hold patient's hand. This side should be in firm contact with the patient's hand. With other hand, you have to feel the radial pulse. You have to raise the hand above the level of head. You will feel the backflow. You will feel the backflow of the blood on this side of your hand. This is radio-radial delay. You have to examine radio-radial delay in both the hands. There will be synchronicity in time. Radio-radial delay is seen in coarctation of aorta. There will be difference in timing in both the hands. Next is radiofemoral delay. There will be synchronicity in both the arteries timing. To examine radiofemoral delay, you have to make the patient lie down. With one hand, you have to palpate radial artery, and with the other hand, you have to palpate femoral artery. So, if there is time difference, this is radiofemoral delay. It is seen in coarctation of aorta.
Now we are coming to the report. Report is pulse rate 72 beats per minute, rhythm is regular, volume is good, condition of blood vessel is soft, character is non-collapsing, no radio-radial delay and no radiofemoral delay found. Now, if examiner will ask you to read the report, then we will first include the identification data of the patient and then the report of the patient, which is as follows. A Hindu female, 21-year-old, named Ritika Singh, student by occupation, resident of house number 4921 Pragatipuram Colony, Raebareli, pin code 442492, Uttar Pradesh, and her report is as follows. Pulse rate 72 beats per minute, rhythm is regular, volume is good, condition of blood vessel is soft, character is non-collapsing, no radio-radial delay and no radiofemoral delay. Thank you for today.